if we have a doctor who is willing to support us with ME/CFS triggered by COVID long haul, what should we encourage the doctor to explore further to uncover multi-system causes?
Yeah, all the things we've discussed today for sure. So different infections, but it depends on what your symptoms are. For my patients, I'm interested in looking at their T cell response with respect to infections that maybe were dormant. So I would look at the Infectolab viral panel. If I suspect tick-borne disease, I'm going to test for that as well, probably through Infectolab or through Igenex. That's where I would start. Also the long haul panel, so we have an understanding of what your inflammatory cytokines look like. Some of them do have to do with spike protein in general, so that's a good start. Definitely look at the hormones. I like the Dutch complete test for women. For men, straight up blood is fine. So the sex hormones, thyroid, all of that can get affected. And it does get affected by inflammation. In fact, there's receptors for a spike protein on the thyroid. So there's the whole system can be affected. So you need that doctor to do a systemic review of you and then decide on the labs based on that.
Yeah. And the other part that I like about the IncellDx test, again, it's not that it's diagnostic, but just looking at if you have really high IL-8s, probably more likely Lyme, could just be chronic fatigue, but I kind of think it's probably more Lyme and IL-6s. And if it's, I think if you find the VEGF is really high, it's time to start thinking, Bartonella, Babesia. Again, these are hints. These are not, I want to emphasize that. One of the things that makes treating chronic illness so hard is that as a doctor, we want tests that are definitive, that I have this test, that means I have that. And what I hated about when I got into this field was I suddenly lost my moorings. Because in the hospital, you had tests that you could depend on. I mean, because when people are near death, the tests get pretty obvious. And unfortunately, when you get into the chronic illness, like I said, you're not dying. And the tests that we have really confidence in are designed to tell you that the organ is failing. And most people with chronic illness, thank God, their organs are not failing. So our tests are not as clear cut. And that's what's hard for doctors who are just getting into this field to get comfortable with. And that's why we get a lot of disrespect from academic physicians, because they go, oh, these tests are all garbage. Well, they're not great, but they actually are useful and they do lead us to effective treatment. So they're not garbage. They're just not, they're not perfect. There's going to be times when you're going to get false positives or people are going to interpret them too strongly.